the American Cancer Society, high in whole grains and fruit and low in added sugar. After 3 months, women in the ketogenic diet group had lower levels of insulin and an insulin-like growth factor (IGF-1) in their blood than the comparison group. This study demonstrates not only high feasibility but also that a ketogenic diet can shift the metabolic environment among women with ovarian and endometrial cancers, said Gower, a professor at the University of Alabama at Birmingham, UAB, Nutrition Obesity Research Center. Further study in a clinical setting is needed to determine whether the ketogenic diet may be an effective non-pharmacologic adjuvant therapy for certain types of cancer, the paper concluded. Ongoing research, more studies are coming. In Gower's study, participants varied in cancer stage and treatment, which may have influenced the results. She is planning to follow up with a ketogenic diet study focused on ovarian cancer patients undergoing chemotherapy, investigating immune function and survival. And the research team who published their mice findings in Nature are now carrying this research into a clinical trial for patients with lymphoma and endometrial cancers. The trial aims to include 40 patients and begin this fall. Cancer patients, survivors and what to eat. AICR recommends that anyone who has received a diagnosis of cancer should receive specialized nutritional advice from an appropriately trained professional. For patients interested in ketogenic diet, it is vitally important that you talk with your healthcare providers, says Alice Bender, MS, RDN, AICR's Director of Nutrition Programs. A dietitian is best positioned to talk with you about what is known regarding the pros and cons, especially to learn if this diet has any research showing the reasonable application with your particular type of cancer and if the ketogenic diet may even be harmful for you. The diet's strict limitation on starchy vegetables, whole grains, and fruits may lead to missing out on vitamins, minerals and other healthy compounds found in plant foods, which can lead to malnutrition, Bender adds. A true ketogenic diet could also lead to digestive and other unpleasant side effects. It requires monitoring and nutritional supplements. It can be difficult to follow. Even for people who comply with the diet, the metabolic effects may vary and the effect on cancer treatment is still uncertain, Brockton warns. There is, however, clear evidence that following a diet rich in plant foods like vegetables, whole grains, fruit, and beans, choosing moderate amounts of red meat and other animal foods and limiting alcohol reduces the risk for cancer and other chronic diseases. It also provides the nutrition needed for overall health and wellness. AICR recommends that survivors who have finished their treatment follow the diet recommended for cancer prevention, unless otherwise advised. That means a diet filled with a variety of plant foods, including whole grains, vegetables, and fruit, with healthy proteins and limited amounts of red meat and highly processed, fatty and sugary foods. For the latest news on lifestyle and cancer survivors' health, sign up for AICR's free monthly recharge.